30 to 40% of the adult population worldwide. Yeah? So it's topics that a lot of us doesn't really pay a lot of attention to it because that seems to be so common, so common. So the subject of hypertension, which is actually a term for high blood pressure, actually is very common and is prevalent, especially in our region. You know? In fact, Malaysia have a very high prevalence of hypertension incidents. Singapore is doing a bit better, I think, because of the healthcare system as well as the quality of life and standards. Right. So today we're going to delve into the hypertension and hypertension's complication. Right. It's a very vast subject, wide-ranging impact to every one of us. I hope that you all will benefit from the information that I provide for you. Okay, first, I think we want to have a definition of hypertension. Hypertension, actually commonly known as high blood pressure, so it's a condition where the force of the blood against the artery wall is too high. Right? So, in fact, from the clinical perspective, hypertension is defined by a consistent blood pressure reading of 140 over 90 mm mercury. So in this case, I think first we have to actually define what is 140 and 90, the numbers. The number at the top, 140, actually represent the systolic blood pressure, which represent the pressure in the artery when the heart beats, when the heart compresses. Right. Then the bottom number, the 90, the bottom number itself is called diastolic blood pressure. And basically, it represents the pressure in the arteries when the heart rests. That means that when it's relaxed. So these two actually form the basis of our blood pressure measurements itself. Right. So for hypertension, in this case, it is usually defined as if you have a blood pressure of above 140 and 90. 140 systolic and 90 diastolic. Okay, now look at the classification first. Okay, first of all, I think in our blood pressure category itself, if your blood pressure is below 120 and 80, right, we actually are considered normal, right? When your blood pressure is between 120 to 129 in a systolic side and still below 80, right, you are considered as sort of elevated, but not really considered as hypertension. We call it sort of clinically non-hypertension people. Now, when your systolic is 130 to 139, or your diastolic is between 80 to 90, you are actually considered as under the hypertension stage 1. In this case, we usually also call it as a pre-hypertension, right? But it's actually technically we call it a hypertension stage 1, right? So it is actually the hypertension stage 2 that is actually we consider as a hypertension. Maybe generally when you say when you are having hypertension, basically your systolic have to be 140 or higher, or your diastolic is 90 or higher itself. Right. So these are important indicators, right? Because as I progress, right, I want you all to understand that one way to control and measure yourself is to understand at what stage you are in, and at each stage of the blood pressure level, right, there are certain things that you have to be careful about, right? Especially when your blood pressure is extremely high, then there's a lot of complication and emergency that could be results. Okay, let's look at what are the symptoms of having hypertension, right? So one of the most common symptoms actually is headache, especially it happens at, if you look at this picture itself, it's at the back of your head, near your neck, what you call occipital regions itself. So when you're having a pain, headache, especially at the back of the head itself, This is one of the very typical common symptoms of hypertension headache. Okay, of course, there are other common symptoms like blur vision, where your eye is affected, your vision is blur, or you feel dizzy, dizzy itself, and sometimes actually you feel a shortness of breath, particularly when you are exerting yourself, right? And also your heart might be run faster. You call palpitation. A heart beats a bit faster or rapid or irregular, or occasionally you might feel that you have some chest pain itself. All right. Now we will talk about chest pain a bit later as we go on. All right. Now, not common, but if you have frequent nose bleeding, it can be a symptom of also hypertension, right? And of course, right, if your hypertension is persistent and severe over a period of time, you might actually have a confusion or even fatigue in that, right? And also, of course, one of the very common problem we have is tinnitus, which is actually a ringing ears itself. This could be also one of the symptoms of having hypertension. So people who are suffering from high blood pressure might find that they have ringing ears, buzzing in the ears itself. So, but all these symptoms are actually very subtle, and they are not necessarily actually related to hypertension. It could be other things as well. So therefore, as a general things itself, I think the more accurate way to determine whether that we are suffering from hypertension, right, or having a hypertension problem, right, the best way actually is to go for a measurement itself instead of relying on symptoms to also detect our state of hypertension. All right, let's look at how prevalent is this. These are one of the few informations that I dig out from the World Health Organization. If you look at it itself, the prevalence rate of hypertension in adults, this is considered as adult population. In Singapore, it's about 31% in 2019. Malaysia, 40%, one of the highest prevalence rate in the Southeast Asia region. In fact, Indonesia also very close to Malaysia, 40%. Australia, better than even Singapore, is 29%, right? So obviously something must be right in Australian side, right? China, 27%, also actually on the lowest end of it compared with the Southeast Asia country itself. If you look at Singapore, actually Singapore, there's a lot more information on hypertension. In fact, hypertension is the second most prevalent chronic disease in Singapore. And only slightly lower than next to hyperlipidemia, which is high cholesterol. Okay. Now, if you look at Singapore's hypertension trend, in fact, there is a worrying trend. In 2007, the prevalent rate of hypertension is only 24%. 2019 is 31%. And in 2021 and 2022, it raised to 37%. So it's a problem. It's a problem in the sense that actually Singapore hypertension trend is on the upward swing, right? And it's not going down, it's going up. In fact, very soon, it probably will catch up to actually against people who are suffering from hyperlipidemia, right? It probably will be surpassed that itself. So it's important for us to actually, especially those in Singapore and Malaysia and Indonesia, put it that way, to take the issue of hypertension seriously, because it is a major underlying cause of a lot of chronic diseases and problems. You will see later. Okay, now, what are the risk factors that the hypertension cannot be changed? Or basically, we talk about what are the epidemiology of it. So first, if you have a family history of hypertension, then you probably have the risk of have a higher risk of hypertension as well. So there's a family or genetic association of it itself. Second, age, right? Which is a very natural progression, because as you get older, your arteries are getting stiffer and narrower, and therefore the prevalence of hypertension goes up with age itself. And in Singapore, right, if you look at it itself, right, when 50% of the population that's age 50 and above, actually, suffering from hypertension. So this is actually how prevalent is it. That means that more than 50% of the older population in Singapore are actually suffering from hypertension, as it is. And the hypertension also differ in the gender side, right? For the men, right, as far as concerned, the prevalence of the incident of hypertension are higher when they're young, at a younger age, whereas for the woman, right, it actually become more prevalent actually at the older age for women. So that means that if you look at it itself, the at the younger age, the men are actually suffering from hypertension at a higher prevalence rate than the women itself. Whereas once you pass the 55 years, right, the woman actually will suffer more from hypertension than the men. Okay, there's another way to classify actually hypertension. We basically classify the hypertension based on the underlying cause, right? So there's two major categories of hypertension. One category we call it essential hypertension, or we call it primary hypertension. Well, basically, it's a very nice term for the doctors who say that now this is hypertension that I really don't know what is the cause. So they lump it as what they call the essential hypertension. So actually, this affects 85% of the adult population. That means that 85% of the people who are suffering from hypertension are not, their causes are not identifiable, right? So then we have another category whereby the hypertension all have a distinct cause itself. So we call it as a secondary hypertension. So in this case, obviously, a condition that can cause secondary hypertensions are renal diseases, kidney diseases, right? Obstructive sleep anemia, pregnancy, right? And medication, right? And thyroid diseases. We will discuss this in detail separately, so that we will look at this secondary cause of hypertension separately. And these are the area whereby that we will also learn how to manage it. So one thing that we must realize is that secondary hypertension is a hypertension that have one distinct cause, but they could be also having primary hypertension. It means that we could suffer from let's say kidney disease caused hypertension, but our hypertension could be also suffer from some other unidentifiable cause. So therefore, basically, the primary and secondary hypertension can coexist itself. So this is where the complication comes. Okay, now another way to look at the hypertension actually is to look at it whether that the hypertension is being treated, the hypertension is being under control, or not under control, or having a resistance to the treatment, or you did not, it's untreated. That means that you have not sought for treatment on that itself. So you look at the Singapore hypertension statistics in 2019, right? In fact, Singapore, if I look at this statistics itself, put it that way, there's still a lot of education to do because 39% of the hypertension patients are untreated, which means that they probably are not interested in getting treatment, or they are unaware that there is treatment that they need, or they probably are unaware of themselves being suffer from hypertension. All right. Now, there's 38%, about equal proportion of it is control, which means that you go for the treatment and the blood pressure is under control. But there is also equal proportion, about 28% of it itself, that actually they get treatment, right? The hypertension is not under control, right? And we call it actually a resistant hypertension. Now, this group is a group that we will also delve to later, right? To be a bit more specific to look at it, because this is an area whereby if hypertension is not well controlled, then a long-term suffering from uncontrolled hypertension, you could have leads you to a lot of complications. And that is where the risk comes in. All right. So let's look at the causes of resistant hypertension. That means hypertension that is treated but not under control. All right. So you can see that obstructive sleep anemia, right? So it's a type of sleep problem, right? That actually when you sleep, your airway is obstructed and therefore you suffer from what we call obstructive sleep anemia problem. And this accounts for the majority of the resistant hypertension. In fact, you look at it, it's about 58%. More than half of the resistant hypertension are due to obstructive sleep anemia. All right. Then followed by what we call essential hypertension, which is hypertension of unknown cause, 31%. All right. The rest are the secondary hypertension like endocrine disorder, kidney diseases, and so on and so forth. Well, we will talk about it individually. So we just talk about it individually to understand what are the relevance of all this. Okay, first, I think we talk about the most important, the major cause of the resistant hypertension, which is actually obstructive sleep anemia. So the cause of hypertension is due to the mechanical problem of our airway get blocked when we sleep. So if you look at this picture is actually not in the right orientation. You should be oriented, be aware by that when you sleep, your face is up, not sleeping when you're standing, right? So therefore, you will notice that the airway is blocked. This is the typical condition when you are sleeping and the airway is blocked, and therefore you will cause actually your blood pressure to raise, your heartbeat to go up because there's a lack of air into your body itself, right? So obstructive sleep anemia was the most common condition associated with resistant hypertension. If you look at this chart, this reports itself, you can see that OSA 64%, 34%, which is actually the chart I showed previously itself, right? So this is actually one of the most common cause of resistant hypertension, right? It's not caused by other things, but it's basically a mechanical blockage of your airway. So I think knowing this itself, right, one of the ways is to learn how to overcome and what are the current treatment options we have. Okay, so let's take a bit of time to understand what is OSA, right? So people living with OSA can be very tired in the day or even fall to sleep. This can be a very dangerous situation. We all know, right? We all know itself, right? Especially you're driving or you're operating a machinery, right? In children, if a child is suffering from OSA itself, right, it can cause problem at school or cause hyperactivity of the children. So therefore, you need to be careful that this is not only happening in older people or in adults, actually children also might suffer from this condition itself, right? So how prevalent is it? 30% of Singapore population has moderate to severe OSA. That's very high. Very high prevalent rates. That means the Singapore adult population, 30% of it, one-third having this problem, right? Some form of actually sleeping problem, right? Now, what are the complications if you're suffering from OSA? First, of course, it can cause sleep disturbance, a daytime symptom of what we are talking about. Very tired, fall to sleep in the daytime. Well, the most important part of it is that it actually can trigger and have a stroke. Right, almost 70% of people who have had a stroke have OSA. So scientific show, which means that it is closely related to the incidence of stroke. If you're having this itself, your risk and chances of having a stroke are very, very high, right? Now, second, obviously, as you say, this is the major cause of persistent hypertension. So more than 35% of people with sleep anemia have hypertension, right? So it can cause diabetics, it can cause depression because you don't have enough sleep or quality of sleep, right? And in fact, you raise your heart failure risk and heart attack risk by 2 to 3 times. And this is a very important factor to consider, which means that the chances of having a heart attack or heart failure actually increases if you're having an OSA, right? And also the risk of motor vehicle accidents is by 7 times, right? And this is for people who driver, this is very dangerous itself, right? So there's a lot of complications associated with this itself. And it's important that we actually understand that, and you can see that it's very prevalent, right? We might not sought for professional treatment. I think that most of us know that we snore. I think snoring is one of the symptoms of having some form of OSA itself. The The more you snore, the heavier you snore. Actually, the more likely that you are suffering from OSA itself, right? So snoring is one of the clinical manifestation of actually OSA itself, right? So let's look at how we can deal with it, right? So of course, there's one technique that currently is been also advocated, right? To deal with the OSA because it's very common, right? We call it position therapy, right? Now, what is position therapy? Actually, position therapy is a technique that preventing the patient from lying in a supine position, which means a face-up position, and promote side sleeping. You look at it itself, that this is a face-up position, and this is the right lateral sleeping. That means side sleeping, facing on the side, lean on the side itself, right? So it is a very useful therapy for OSA patients who are not treated by the CPAP, which is a continuous positive airway pressure. This is actually a device that if you see a doctor will put it on your mouth, and then when you sleep, they will have a what they call airway pressure of air into your mouth. This is very, very inconvenient, and I don't think there's a lot of people willing to go through this type of treatment anyway. You know, even though you're diagnosed with it, they will look at it itself. It's a very, very what I call inconvenient form of actually dealing with sleep itself. So another alternative obviously is that try to learn to sleep on the side. If you're snoring, and likely you might have OSA, my advice is that one of the known techniques today is that try to sleep on the side, not to allow yourself to sleep on the face up itself. You look at this itself, right? The sleep span in body position for various types of people, right? For normal person, normally about 30 or 40% of the time when they are in a bed, they are face up, the supine position. Whereas if you are having a severe OSA itself, actually you have a higher percentage of the time you are sleeping with a face up position, right? In fact, there's a sort of study in China side say that 1/3 of Chinese population subjects with OSA are suffering from this what they call the positional obstructive sleep anemia, which means that their sleep, the face-up position are much longer than even their what they call the lateral position itself. So therefore, if you can, right, try to actually sleep on the side when you snore, right? So this will help to reduce actually the severity of the OSA affecting you. Okay, now the other secondary cause of hypertension actually the endocrine disorder. So there are many endocrine disorders. I will highlight the important one, the common one itself. One of the most common one are actually what we call the primary endosterism. In short, we call it PA. This is the most common cause of endocrine hypertension, which is curable, right? So basically, the prevalent rates of it itself is about more than 10% among the hypertensive patient and about 20% among those with resistant hypertension. So for those who are resistant hypertension, this amount to about 20% of the patient that is suffering from it. Now, what causes what they call primary endosterism? Basically, it's the overproduction of your what they call androsterone. Right? This is actually hormones which regulate sodium and potassium level in your blood, right? So because this hormones is overproduction itself, right? So very often actually it leads to sodium and water retention, and consequently, basically you have hypertension itself, right? So one of the signature characteristics of this type of hypertension is that you will have suffer from low blood potassium level. Right. So we call it hypokalemia. So henceforth, if you are having a hypertension and you are suffering from low blood potassium level, chances are that you actually are suffering from PA, right? Primary endosterism. So therefore, what are the risks or what are the complications if you are suffering from this itself? Well, you have a higher risk of heart attack and you are higher risk of kidney failure. All right. So what are the cause of this PA? basically they are due to benign tumor in either one or both of your adrenal glands, right? The adrenal glands is actually sitting on top of the kidney. You can see from here, right? So this gland is the one that is actually having some also benign tumor and causing the excessive secretion of the hormones itself, right? So this can be treated, all right? This condition can be treated, and with lifestyle changes, the medication, most people have a very good, excellent outlook on treatment. So therefore, if you are having it, get treated. Go for treatment itself, right? Okay, now another endocrine disorder that's quite common, but not as common as the PA, is actually the Cushing syndrome. So what are the typical symptoms of Cushing syndrome? Basically, there are a few that I think you all see. See from this lady, you can see from there that there's a red cheek, right? And a moon face. These are very characteristic symptoms of people who suffer from Cushing syndrome. And this is due to the excessive cortisol production by the adrenal glands itself. So basically, it causes your body's hormones, right? Production, excessive of production of the adrenal glands itself, and then it affects. What are the complications? Inside the Cushing syndrome itself. Basically, first of all, of course, it affects your hypertension, blood pressure itself. It also can cause osteoporosis, type 2 diabetics, and a series of multiple infections, which means that immunity is going down. And of course, very important actually is that the loss of muscle mass strength itself. So these are the actually typical complication of this condition. But one of the trigger point of it itself is basically due to the tumor in the pituitary gland itself. So as far as concerned, it also will trigger hypertension, but the condition can be differentiated from others is because that you can see very typically the face of it itself is the moon face and the red cheek itself. Okay, what are the other secondary hypertension causes? Among them, I think I want to highlight medication because this is more common and more important for us to understand, right? What are the medications that can actually cause your blood pressure to go up? One is actually the non-steroidal anti-inflammation drugs. We call it NSAID. These are the painkiller, common painkiller, right? And therefore, taking a painkiller itself can actually cause your blood pressure to fluctuate and go up. So, if you are taking oral contraceptives, this also can actually raise your blood pressure. If you are you are taking decongestant, over-the-counter medication like decongestant, which actually can also increase the blood pressure, right? And then, of course, taking steroid medication, corticosteroid, can lead to hypertension as well. So these are the types of medication that if you are taking it itself, then need to monitor your blood pressure and be aware that sometimes your blood pressure is due to the medication itself, right? Of course, what are the things you can do with it? One of the things obviously is that you can try to discontinue. If you don't need to take painkiller, don't take, all right? Or if you need to take for medical reason, then you try to see whether you can switch to medication that does not actually cause your hypertension, right? So you can tell the doctor and see whether the doctor can switch to the alternative medication that have lesser effect on the blood pressure itself, right? Of course, this is where the supplementation comes in, right? So it is actually important that while we might want to take medication to treat other condition, and as a result, the medication side effect cause hypertension, right? We also can actually mitigate the hypertension through supplementation, and learn to use proper supplementation also can actually help to mitigate the hypertension effects. Okay, now another cause of secondary hypertension actually is hypertension disorder of pregnancy, right? Especially the condition of preeclampsia, right? So actually, preeclampsia is a medical condition that is affecting pregnancy after more than 20 weeks of gestation, right? Then if you're having hypertension, and the hypertension is not just a pure hypertension, but hypertension affects other organs like kidney or other things itself, then you have a condition we call preeclampsia. Now, preeclampsia is a very serious medical condition during pregnancy itself, right? What are the impact of it itself? First, on fetus itself, right? It will affect the fetus. You have growth restriction, right? You have preterm delivery, right? You have placenta eruption. Basically, it means that you will have abortion, right? Respiratory distress, retinopathy, prematurity, right? Sepsis and stillbirth and all this itself. These are all very serious conditions on the fetus. On the mother itself, right? Hypertension, not only cause hypertension, you will have future hypertension as well as cardiovascular diseases, right? Will cause kidney injury and have a risk of end-stage renal diseases itself, right? You cause liver failure, right? You will have heart problem, right? You have central nervous system damage and strokes. You cause seizure and diabetics. Mother as well have a lot of complications, right? When you have this condition during your pregnancy, it's a very serious condition. Now, what are the risk factors, right? So one of the major risk factors is when you have previous pregnancy, you are having hypertension, right? So when the mother is in the previous pregnancy is really suffering from hypertension, then you have the risk of actually suffering from preeclampsia. Or the mother is suffering from chronic kidney diseases, or the mother is suffering from autoimmune diseases like SLE, right? Or she's suffering from diabetics, or she have chronic hypertension all the while. These are the major risk factors for women who are getting pregnant, and they might run the risk of having a preeclampsia. Now, what are the moderate risk factors? And here I just want to mention that that's the reason why that we always advise women, right, to give birth early, because that if you give birth older than 40 years, right, you have a risk of when you give birth, you are suffering from preeclampsia during pregnancy, right? So also, pregnancy interval of more than 10 years, that means between 1 and 2 pregnancy, the interval break is too long, right? Or you are having obesity at a first clinic visit. That means that you're over obese itself, you will have the risk also, right? And of course, you have a family history of preeclampsia. So these are all contributing risk factor. And put it that way, right? So if you are going to have babies, right, please take note of all these conditions to avoid that having increased the risk of having preeclampsia itself. All right, now let's talk about complication. Hypertension complication itself. I think the root cause of hypertension complication, as you see, the blood pressure is the pressure that we measure on our artery, right? So basically, actually, the artery itself is the root cause of hypertension. Now let's look at it itself, right? What hypertension can do to our artery? Hypertension damage and narrow the arteries, basically. So you can see from here that the hypertension itself, over time, okay, our artery is getting actually much more clogged, right? And as the blood pressure and attention, what we call the blood vessel is weaker and narrower as we get older, right? Then this increase the tension in the walls of artery, right? So as far as concerned, it will aggravate and accelerate the damage of the artery itself. So this is actually the root cause of hypertension, right? So when your blood vessel is damaged, right, or your blood vessel is actually blocked, right, depending on which part of the blood vessel. If your blood vessel is in your brain, it will cause stroke, for instance. Blockage of blood flow in your brain, you cause stroke, right? But if you have a blood vessel in your heart, the blockage of blood flow into your heart will cause heart attack, right? So we call it coronary artery diseases for the heart blood vessel. We call it cerebrovascular diseases for the brain blood vessel, and for the blood vessel that's going to our hands and legs, the limbs, we call it peripheral arterial diseases. Now, when we're having a problem with our blood vessel, it doesn't happen only in one type of vessel. Basically, our whole body affected, right? So therefore, you will see that there is an overlap of what they call the blood vessel diseases cross, right? So most of us, when we suffer from coronary artery diseases itself, likely that we will also suffer from some form of peripheral arterial disease or risk of cerebrovascular diseases or stroke, right? These are overlapping because it's a blood vessel that affects every part of our body itself, right? So bear in mind that because this is a disease of blood vessel, and the blood pressure is a clinical manifestation of blood vessel problem, right? Therefore, the impact of the hypertension actually is very vast, very vast. So let's look at it. What are the complications? Hypertension complications are severe and widespread, affecting various body systems. As I mentioned, because our blood vessel runs through every part of our body itself, right? It can cause dementia, right? It can cause bleeding in the eye. It can cause blur or loss of vision. It can cause irregular heartbeats. It can cause what they call heart attack or stroke, right? It can cause heart failure. It can cause erectile dysfunction for the male, right? It can even cause what they call artery damage or aneurysm, so on and so forth, right? You can see from there that the complication of hypertension is very, very extensive. Some are very severe, right? We will discuss on some of it as we go on, right? Some are not that severe, but then it's still bothering. Okay. One of the most important complications, the strongest, one of the most important complication of hypertension is stroke. All right. So let's look at some of the statistics about stroke itself. Right. This is a complication of hypertension. Hypertension is strongest independent risk factor for stroke. Right. That means that if you're having hypertension, right, your risk of having stroke is highest. And that means that if you look at here itself, what is the cause of hypertension death? Stroke account for 65% of hypertension cause mortality, right? Heart disease account for 25%. These two alone account for 90% of cardiovascular mortality, right? So nothing else matter. Actually, stroke and heart disease itself, 90% of the time you're going to die of these two complications if you're having hypertension, right? So if you look at what are the risk factors for stroke, here there is a study show you the relative risk factor for each of the lifestyle factor in here, right? So not considering your irregular heartbeat and left ventricular hypertension, these two are conditions that actually a patient might have, but we're talking about what they call the lifestyle factor, risk factor. You can see that hypertension is have the highest risk ratio of 11.2, followed by sedentarism. That means that basically you do not have enough exercise, right? The risk of having a hypertension if you are having a sedative lifestyle is 6.6, right? If your good cholesterol is low, then your risk is 5. Then if you are a heavy smoker, your risk is 2.8. And then you have a diabetic, your risk is actually 2.4 and so on, right? So therefore, if you look at it itself, among the lifestyle factors itself, hypertension is the major risk factor for stroke, right? So you want to reduce the risk of stroke, first of all, control your blood pressure. That's the bottom line, okay? So let's look at stroke. Since it's a very important part of hypertension, and in fact, if you look at it itself, right, stroke is the second leading cause of death and the disability worldwide. In fact, death is not a problem, right? It's very fast. But disability from stroke patient is very, very burden. It's a really major health burden itself, right? So what type of stroke? Let's look at what type of stroke. There are actually two types of stroke. One type of stroke is actually due to blockage. We call it ischemic stroke. So this account for about 80% of the stroke, in the occurrence of the stroke. 80% of our stroke actually is due to the blockage of the blood vessel to the brain, right? Now, another 20% of a stroke is actually called hemorrhagic stroke, which means that the blood vessel to the brain rupture. This kind of stroke is actually more dangerous than the one that's actually ischemic stroke, which is the blockage itself, right? So we also heard of the term of what we call the mini strokes. We call it transient ischemic attacks, TIA. These are strokes that is actually mini strokes that actually attack you, but then you will actually the symptom is over, then you recover. You don't feel that it's actually like a stroke. So these are actually the smaller blood vessels get blocked, and then actually the condition actually is transient. All right. Now, important, since we are talking about stroke, I think that the first thing is the daily our daily life, we should be aware of sign of stroke itself. Very simple. There are three things that you need to look at. Right. First thing is look at the face. If somebody is suffering from stroke, the face, one side of the face will be not balanced with the other. These are very clear symptoms that you must recognize. The other is that the arm itself, one of the arm will not able to move. The other arm will move. So you actually can see the patient, whether the person who was suffering from stroke, whether both arms can be raised up together or not. Then you will know whether there is a suffering from stroke. And of course, the speech itself can be slurred, the speech is affected, right? These are most obvious signs of stroke itself, right? There are other signs of stroke like the eye, they have a blurred vision, right? And a balance problem. But they are more subtle. And these are more subtle. It's because there could be other problems that associate with this itself. Now, important thing, why I'm talking about signs of stroke is because the treatment for stroke is time. The treatment for stroke is time. You must send a stroke patient within 5 hours to hospital to get the antithrombotic medication. Right. This is actually true for stroke that cause blockage, right? Ischemic stroke. The patient must reach the hospital for thrombolysis treatment, thrombolysis within 5 hours of onset itself. So if you are able to reach there and then within 5 hours, right, the prognosis is very good. You can be fully recover. But every hour of after that itself, the chances of full recovery drops very rapidly. So the treatment is time. Remember, for stroke. Okay, now let's talk about stroke a bit deeper itself. First of all, if you have a stroke, you are having a high risk of the stroke recurrence. So this is a very important thing that you must know. Once you have a stroke, or even you have a TIA, right, a mini stroke, if you know that you're having a mini stroke, then you must be aware that your risk of having a stroke coming back is very, very high. You should take precaution yourself, right? And in fact, recurring ischemic stroke is recognized as a major public health concern. Why? Because if you look at it itself, right? Now the stroke recovery, we just discussed there's two types of stroke itself, right? The stroke that's causing blockage one, right? The recurrence rate itself actually is slightly lower than the one that's actually rupture. The rupture type of stroke itself, the recurrent rates are higher than the ischemic stroke itself. But nevertheless, their recurrent rates are very high over years of follow-up, which means that you always have a higher risk of recurrence itself. Now, another one that very interesting is that if you look at it itself, right? If you are older and you have a stroke, your risk of recurrence of stroke is very high. So the old people have a higher risk of recurrence compared with younger people. Right. Therefore, for old people, you are having a stroke, be very, very careful about it because your risks are much higher for recurrent stroke itself. Now, why recurrent stroke should be avoided? Let me share with you, right? The percentage survival for recurrent stroke and no recurrent stroke. If you are not having a recurrent stroke, this is the chart showing your percentage of survival over 15 years, right? Which is probably okay, pretty good, right? You are about 90% survival after 10 years. 90% you're still alive, right? But if you are having a recurrent stroke itself, right? After 10 years, your chances of survival will drop to about 60%. So you have 40%, your survival chance is only 60%. So there is a big significance in terms of survival. So therefore, avoid recurrent strokes and take precaution on it. Okay, right. Another factors, right? We all know the stroke patient will suffer from post-stroke dementia. But put it that way, all right? No, you don't need to have stroke to have dementia. In fact, hypertension itself causes dementia, right? So the lowering blood pressure will significantly reduce the dementia risk for hypertension. Now let's look at this chart itself. This is actually a chart showing the processing speed of the participants with actually the SBP, which is a systolic blood pressure, right? 5-year follow-up on the study of a person with the high reading, the systolic blood pressure, right? Those who are having normal blood pressure, less than 120 milligram of mercury, which is actually the normal blood pressure, systolic blood pressure itself. Their processing speed level is here, right? But if you look at the high hypertension, that means people who are having hypertension, which is having a systolic blood pressure of 140, right? Their processing speed drops in a straight line, right? So this is first to show that as the blood pressure as you are having higher blood pressure, you are suffering from your brain damage itself, and therefore your processing speed is declining. Okay, let's look at from another way itself. What are the risks of having cognitive impairment, right? So for a person that is actually under normal blood pressure, 100 to 122 systolic blood pressure, or even the hypertension, 123 to 135 itself, right? You don't have a problem. Actually, your risk of cognitive impairment are not there. You are very safe. But the moment you pass the hypertension stage 2, which is this hypertension stage 2 stage already, your risk of having cognitive impairment actually go up 3.7 times of normal, right? And if you're having a hypertension 140, systolic pressure 146 and above itself, your risk go up to 8.6 times, right? So this shows you that hypertension is closely related to dementia because the cognitive impairment risk go up very significantly, right? Now, another chart here is very interesting. I just want to share with you. Same thing, we're talking about the blood pressure, all right? As well as concern, also we talk about the risk of dementia. So these are a relative risk scale. So you look at it itself, for people who are young, age between 40 and 59, right? This is your upper reading. SBP is the upper blood pressure reading, right? If your blood pressure go up, your risk of having a dementia go up very rapidly for young people, compared with people who are 70 to 79 years old. So for people who are 70 to 79 years old, your blood pressure doesn't affect your dementia risk at all. So therefore, the younger you are, the higher the risk of having dementia as your blood pressure go up. Same thing for your diastolic blood pressure. Same thing. That means at the lower reading itself, same thing that if your lower reading is going up, younger people have a much higher risk of having dementia compared with older people. So important, the impact of hypertension on dementia is more pronounced for young people than for old people. Therefore, for younger people, right, if you don't want to have dementia early, right, you should address it as early as possible. Older people, doesn't matter already. It doesn't matter already. Okay, exercise. Now, we talk about that, obviously, we must talk about some solution for that, right? Now, I give you a chart to show you that exercise can be a very viable solution to reduce the risk of dementia, especially for ischemic stroke patients. right? You can see from here. Here this study that, right, compared with no exercise and a regular exercise, the incident probability of having a dementia, right? So if you do not exercise, right, up year after your stroke, right, you can see from here that your risk of having dementia go up in a straight line if you don't have the exercise. But if you are having regular exercise, right, after the stroke itself, your risk of dementia actually is increased, is very, what they call, flat itself. So you can reduce the risk of dementia after your stroke, right? And in the same token, which means that if you want to reduce dementia, whether you have stroke or no stroke, you actually exercise helps, right? The bottom line is that the exercise helps to reduce the risk of dementia itself, right? So very important. We know that 20 to 30% people who have a stroke will develop dementia within the first year. This is a very common statistics, right? And then the 30 to 40% might develop dementia 3 to 5 years. Especially for stroke patients, please exercise. Right? Please exercise because the dementia risk have to be reduced. Otherwise, you will be very debilitating in terms of quality of life. Okay, now what are the nutraceutical that is actually benefiting people for stroke recovery or people suffering from risk of dementia? So I give you a list here, right? Talking so much, obviously, you will also need to know what are the things you can supplement, right? So among them, right, the one that's considered as supplement on the top, the green one, you can see that acetyl L-carnitine, alpha lipoic acid, astaxanthin, right? Vitamin B12, CoQ10, plasmalogen. So I mentioned this because you are in anatomy. You have a product called plasmalogen, right? Omega-3 fatty acid, magnesium, and zinc, right? So I did not put in a bit more detail because that I think that currently we are not talking about hypertension. We're talking about our supplement that's benefiting people for neural regeneration, stroke recovery. So these are all quantified ingredients or supplement that actually have a clinical basis to substantiate that they might benefit stroke patient. Okay, for the TCM side, the herbs itself, right? These are the common TCM herbs that is known to able to help in blood circulation and neuroregeneration. Among them are the Chinese cat's claw, 钩藤, curcumin, 姜黄素, ginkgo biloba, right? 银翘叶, Pentax ginseng, 人参, and Pentax noto ginseng, 山芪, right? So these are the common popular TCM herbs that's been known to be effective for people for stroke recovery. So you might take it as a reference for people who are suffering from stroke and you want to recover this supplementation that can benefit them. Okay, now hypertension, atherosclerosis, which means that the blood vessel hardening has been blocked itself, right? So what are the risk factors for that? Is actually one of the risk factors is our cardiovascular disease and cerebral disease itself, which is the disease of the brain blood vessel itself. Now, if you look at this chart itself, right, how important and how major is the risk factor for cardiovascular disease? We list all the current criteria, condition that can contribute to cardiovascular diseases risk. So you can see the hypertension remains one of the highest risk factor among other factors like current smoker, diabetics, dyslipidemia, which is a high cholesterol, metabolic syndrome, basically actually is diabetic, diabetic conditions with all the other dyslipidemia or hypertension together, right? And overweight and obese. If we look at it itself, right, hypertension still stands the highest, what they call attribution risk factor. right? Which means that you have the highest risk factor among all these factors. Now, you look at the risk among different types of cardiovascular diseases itself, right? And in here, you can see this chart, which indicate hypertension stage 2, hypertension stage 1, right? So both are hypertension. So let's look at hypertension stage 2. If you're having hypertension stage 2, what is your, what they call the lifetime risk factor itself? For cardiovascular diseases, actually, you can see that as the age go older, your risk go up very high, right? Now, very interesting, you can see from there that the risk go up for the stroke itself, also it go up very high, right? For as you get older, you get the stroke go very high for this is for the stroke. Now, the hemorrhagic stroke is the one that show a very different pattern, which means that at a very early stage, even at the early years, right, the risk of having cerebral hemorrhagic stroke itself, right, is still very high if you have hypertension, which means that the hypertension, right, is very dangerous for young people, especially young people, because they have a high risk of hemorrhagic stroke itself. Older people, right, tend to actually suffer from ischemic stroke. So therefore, this is a very dangerous area, whereby that if you are young and you are having hypertension, beware that your risk of having hemorrhagic stroke is very, very high in that. So therefore, it's important to actually manage your blood pressure, especially when you are young. Okay, so we talk about coronary artery disease as one of the complications of hypertension itself. What is coronary artery disease? Basically, we know that hypertension damage the artery to the heart, right? So what can this blockage of a blood vessel to the heart can lead to what? First, it can lead to a chest pain. The initial symptom is chest pain, then you can lead to irregular heartbeats, right? Then at the more extreme case, it can lead to heart attack, right? So basically, I think the very common first stage of symptom usually is chest pain itself. You can see from here, right? Among the three factors that we are talking about, blood pressure, the systolic blood pressure actually have the most sensitive and highest risk factor among you having high cholesterol or you're having what they call diabetic, high blood glucose. In fact, the hypertension, the blood pressure is the one that having highest what they call hazard ratio itself, which is the risk ratio. Now, in talking about the chest pain and the heart attack because of the blood vessel block itself, everybody is know that from time to time we do have some chest pain, right? But it is important to recognize that if you are having hypertension, right, and you're having chest pain, then you have to be very careful that it could be a sign of heart attack. Right? How to differentiate a sign of attack from other type of chest pain? First of all, these are the signs of heart attack that I want to share with everybody, right, as a common knowledge, right? First of all, you will have chest pain or discomfort, right? You suffer from shortness of breath, and you will have the pain traveling down from the jaw, the neck, back, the arm, and shoulder. These are very common symptoms of heart attack, and these occur to both male and female, right? But for the female, right, there may be additional symptoms like feeling nauseous, lightheaded, or unusually tired. Other symptoms also can be, especially like breaking out of cold sweat or heartburn. These are also common symptoms that can happen during heart attack, right? Now, as heart attack is an emergency, so I just want everybody to know, right? If you are not sure of the patient whether he's suffering a heart attack or not, I think it's best to take precaution and just send the patient to hospital, right? That is something that my advice, okay? Now, of course, now, if you're having a chest pain, right, and you want to worry, you might worry that it could be a sign of heart attack. Here are some sort of advice in here for you to learn to differentiate between some other types of causes of chest pain, then most likely chest pain that caused by heart attack. So in here, I think that I just want to share with you, if your chest pain is on the right side, chances are that you might not be suffering from a heart attack. But if your chest pain is on the left side, right, chances are that you might be suffering from a heart attack, or your chest pain in the central. Right. So just to, I mean, there are too many things for you to recognize. Never mind about that. But important is that sometimes a chest pain might be a false alarm. So therefore, one way to differentiate is that a right side chest pain generally is safe, is not a sign of heart attack. Left side chest pain generally is the sign of heart attack. So therefore, don't take your chances if it's the left side chest pain. Okay. Okay, what are the useful supplementation for people who are suffering from heart diseases? That means heart blood vessel block. All right. So here are some of the natural compound that is proven benefits itself. Together with their pharmacological actions, the antithrombotic class, which means that prevent blockage itself, right? Compound like garlic, nattokinesis, which is an enzyme, Chinese TCM, Pentax notoginseng, and Salvia minitoriza, which is actually also, these two are the TCM herbs, right? Garlic and nattokinesis are more of a supplement, and garlic is a herb that we all know, right? So garlic is a very powerful antithrombotic herb itself. So it makes sense for you to eat more, Right. Another supplement, thing that you want to do is prevent your blood vessel from hardening. So we call anti-calcification. So the natural compound for anti-calcification is vitamin K2, right? Then you have a class of anti-atherosclerosis compound, which is anti-inflammatory. So in here you can find curcumin. Curcumin is actually active ingredient from turmeric. All right. You have garlic again. Garlic also anti-inflammatory. Omega-3 fatty acid. Wow. Now you can see that the fish oil is anti-inflammatory. It helps in your anti-atherosclerosis. All right. That means that it helps to protect your blood vessel as well. And resveratrol. Okay. So these are useful compounds. If you're suffering from heart condition, heart diseases, it doesn't hurt for you to supplement with this compound. Okay, another complication from hypertension is heart failure, right? Hypertension leads to heart failure, right? So I think that you look at it yourself. I don't have to explain it because we have a lot to cover, right? Now, symptoms of heart failure are very common. Is what shortness of breath, fatigue, right? Chest discomfort, chest pain, right? Loss of appetite, and your legs are swelling, water retention, leg swelling. These are symptoms of heart failure. Right. Now, what are the risk factors for heart failure? So since we talk about complication of heart failure, right? You look at hypertension. Hypertension is not the highest risk factor for heart failure, but it is a significant risk factor, right? Diabetics actually is a higher risk factor for heart failure than hypertension. If you look at this study itself, right? But if you are having previous heart attack, right? You are having previous irregular heartbeat, right? Now you're suffering from irregular heartbeat itself. You are also having very high risk for heart failure. So this is just a general understanding of the risk factor for people suffering from heart failure. Now, put it that way. We talk about heart attack, right? We talk about heart failure. Actually, heart attack, heart failure is an important complication of heart attack. That means that after your heart attack, you have a high risk of having a heart failure, basically. And you look at it itself, right? If you are having a heart attack, and then if you are having a heart failure, right, after the heart attack, your long-term survival of it itself goes very, very low, right? Over the 10 years, your survival chance is about less than 30% of survival, right? Whereas after the heart attack, if you prevent yourself from having a heart failure, right? Your chances of survival is much higher compared with those with heart failure itself, right? So very important, put it that way. Now talk about blood pressure. Now in here, right, reduction of blood pressure is more effective for heart failure than CAD, cardio, uh, cardio, the heart disease itself. Huh? So as far as concerned, if you are having a heart failure, right, compared with you are having a heart problem, heart disease itself, reducing your blood pressure is more effective for heart failure. You can see from this chart itself. So therefore, it is important to recognize that more so for heart failure patient, that controlling your blood pressure is more important than actually for having heart failure patient compared with heart attack patient or what they call a heart disease patient. Okay, now another complication from hypertension actually is your blood vessel actually having a weak part of it and you get bulged up, bulged up. So we call aneurysm. An aneurysm can happen in any part of our artery itself. You can see you have it in the abdominal side. You can have it just after your heart side, which is the thoracic, which is the upper part of the abdominal itself, right? So aneurysm can burst, leading to internal bleeding. Aneurysm can also cause blood clot in artery. Both of these conditions can be life-threatening. So therefore, hypertension is a major risk factor for people who are suffering from a weak blood vessel. So we know, very simple logic, right? If your blood vessel, if your artery is weak and there's weak part of it itself, if your pressure is too high, you'll burst, right? And this is very dangerous. Once you burst, it can be life-threatening. Okay, now we talk about one of the most feared acute complication of hypertension. Now, this is a lot of people might not be aware, but I want to highlight that in the case of people who suffer from hypertension, right, this risk is real and actually is acute. It's very dangerous, and you must be very quickly aware of the importance of the timing of sending the patient to the hospital in time, right? We call it aortic dissection. Aortic dissection is actually the most feared acute complication of hypertension. What happened is that actually the innermost layer of the artery, the aorta, right, is actually tear. It's been tear. So when it's tear, the blood will run in between the layer of your artery itself, right? Now, look at the risk itself. Hypertension are associated with high risk of aortic dissection. You can see that from this study itself, patient with acute aortic dissection itself, 77%, from 70, average of 60 to 77% of them are suffering from hypertension. So you can see that hypertension actually is one of the major risks of people who are having the aortic dissection problem, right? Compared with all the other factors itself. Now the problem with this is that this type of aortic dissection actually have very poor survival on onset, right? 20% of the patient with aortic dissection die before reaching hospital. 30% of them die during hospital admission. So they have a fatality rate, a mortality rate of 50% survival. Right? So it's a very, very acute and dangerous complication of hypertension itself. More than 50% of patients will die before when you reach hospital, right? So this is one of the most feared complication of hypertension, and therefore it's not necessary that you have to be a very high pressure hypertension, high blood pressure to suffer from this. Even if you have a mild stage of hypertension, you could also run the same risk itself, right? So beware that these are the actually complication of hypertension. Okay, one other complication. One of the things that is very common actually is the blood pressure. High blood pressure affects our eye blood vessel and cause the bleeding of the bursting and bleeding of eye vessel. So this is a typical eye that actually having a hypertension problem and the blood vessel burst there. So you have damaged your blood vessel to the retina and causing a vision problem, right? So how prevalent is this problem? Actually, it's very common. Mild hypertension, the prevalent rates of this problem is 35%. Moderate hypertension was 34%, 35% prevalence rate. And for severe hypertension case, right, 85% of them will have this problem. Right? So this become a very common problem for the eye when you have hypertension. Okay, now we talk about the last complication is and hypertension is actually on the kidney. Kidney diseases and hypertension are closely related, right? So let's look at the major cause of chronic kidney diseases. If you look at it itself, right, the major cause of CKD, chronic kidney diseases itself, 44% is due to diabetic, 29% is due to hypertension. So hypertension is the second leading cause of chronic kidney diseases itself. And if you look at another statistics, right, for people who suffer from CKD, right, their blood pressure is poorly controlled, which means that you can see from here, right, more than 60% of the CKD patients are suffering from hypertension, which their blood pressure is 140, above 140/90. Right. So that means that very common to see that CKD patient suffer from hypertension because they are closely what you call related. Okay. Now we know that this chart show that actually as your blood pressure go up, right, in here, go up in here, mean blood pressure going up, right, your kidney function, which is measured by the glaucoma filtration rate, GFR. Now, this is a measure of your kidney function itself. As your blood pressure go up, your glaucoma GFR rate actually goes down. So this study have actually is a cumulative of a lot of clinical study and show that actually as your blood pressure go up, actually damage your kidney and your kidney function go down. So, right? So we just want to let you know that you do not have to doubt that the blood pressure, but the complication of hypertension itself is actually can affect your kidney and your kidney function will go down as your blood pressure go up. Okay, let's look at how prevalence and actually for kidney patient, right? So you can see from here that, right, this chart itself, we show that in the diagnosed hypertension category itself, right, more than about 20% of the CKD stage 3 and stage 4 patients are suffering, they are suffering from hypertension, right? So the higher, the more severe your CKD patient, right, the more likely that you are suffering from hypertension itself. Now, another way to look at it itself is that what is the probability of developing chronic kidney diseases when you are having hypertension? So if you look at it itself, right, if you are in hypertension stage 2 itself, over the years of 10 years itself, your chances of probability of suffering from hypertension or kidney disease is more than 50%. That means that if you are suffering from hypertension over the course of 10 years, it is likely that a 50% chance that you will suffer from chronic kidney diseases. So the higher is your blood pressure, the higher the chances of you suffering from chronic kidney diseases itself. Okay, now there is another complication which is actually a hypertension crisis. It means that when you are suffering from hypertension and your blood pressure is not in control, then very high, and we will have a situation we call crisis itself, right? A crisis is when your blood pressure raised above 180 systolic and 120 the diastolic itself. Now these symptoms are severe symptoms and emergency, right? So what are the hypertension urgency itself? First of all, you'll find the patient normally at this stage will have severe headache, shortness of breath, nose bleeding, and severe anxiety. Very severe symptom of hypertension, right? Now, if this symptom is accompanied with a chest pain, back pain, numbness, or change in vision or difficulty speaking, you should admit the patient to ICU immediately. This becomes a medical emergency. So for people who are suffering from acute hypertension and having this symptom plus symptom of organ damage like chest pain, back pain, numbness, weakness, change in vision, then this should treat it as an emergency, right? This patient should be sent to hospital immediately. Remember, so when you are monitoring people with severe hypertension, do be careful and know when to send them to hospital. Don't self-treat. Okay? Now we talk about how to manage blood pressure. Back talking about all the complications, I think it frightened a lot of people, right? But okay, first of all, you must recognize that blood pressure increase with age, right? So if you look at it itself for young people, your normal blood pressure, let's say that if you're 20 years old, your normal blood pressure is 120/79 or 120/80. But when you are age 60 to 64, right, your blood pressure, normal pressure is considered 134/87. So you don't have to worry about when you get old and then you say, hey, how come I measure I'm not 120? When you are that old, your blood pressure is expected to be increased anyway. So this is still considered as normal, right? So remember, blood pressure increase with age itself. There's not a static number, it's a number that goes with age. Okay, blood pressure measurement. We talk about it, we talk about blood pressure. So do we know how to measure accurately? Right? First, right, before you measure, you must rest. So I try not to exercise, right? So as far as concerned, your body must be in a stable state, not in an excited state itself, right? So before you take your blood pressure meter to measure you, you should at least sit there for about 5 minutes to calm down yourself, right? So a lot of people, when they go to hospital, they straight away go and measure blood pressure. You have what we call the white coat hypertension, which means that you go in there, you measure, right, your blood pressure is going to be higher than your normal because of the situation, all right? Right, so positioning, right? So actually both arm initially to, you should measure both arm, right? So see whether any both arm any different. You should take the arm reading, the higher reading one. Take the higher reading one. If your both arm there's a difference, take the higher reading one. Important thing, all right, is that when to take the reading, right? So I show you this chart in here, right? These are your systolic blood pressure fluctuation over the days and night. These are your diastolic blood pressure fluctuating over day and night. So then you can see from there that what we want to measure our blood pressure is to capture the blood pressure at its highest point, right? Because you don't want to catch it at the lowest point, no use. It's of no relevant to you, right? You want to make sure that at the peak, when is your peak and whether the peak is actually exceeding the danger level or not. So the best time to measure you is actually before bed. You can see from here that before bed, there is a peak there, right? And then the best time to measure is when you just awake. You can see from there that when you sleep, your blood pressure go down. The moment you wake up, the blood pressure shoot up. So this is the 2 points that you should be measuring your blood pressure. All right. Okay. Now, what are the treatment guidelines for people with hypertension? I will quickly go through it. All right. So basically, these are the current practice. All right. So grade 1 hypertension, where your BP is greater than 140, and the diastolic is 90 to 99. Basically, if you do not have risk factor like acidomic cardiovascular diseases, you do not have chronic kidney diseases, diabetic or hypertension or organ damage itself, you consider beyond the risk factor, you basically don't need to actually even take medication, right? You can take medication if your condition is still not controlled after 3 to 6 months. And so when we talk about non-pharmacological therapy, means that your lifestyle intervention, food, diet, lifestyle intervention. But if you are having grade 2 hypertension, or you have hypertension with risk factor, then the doctor will prescribe medication. right? So I will skip the medication part because this is a doctor's job. We don't have to worry too much about that, right? Now let's look at the non-pharmacological approaches for your hypertension management. This is the important part that we want to learn, right? So first of all, lifestyle modification, very simple, right? We control your weight, exercise, right? I will spend a bit time on the exercise that later. Diet change. Basically, you actually, the most important in the diet for people with hypertension is salt reduction. I tell you, other than that, whatever type of diet, we call it DASH diet or Meridian diet, all that is less critical. The most critical part in the diet is the salt. Reduce the salt, all right? Then alcohol moderation, right? These two are the things that you have to do. And then other lifestyle is that if you're a smoker, don't smoke. And manage your stress, because stress increases your blood pressure. We all know. We all know that. So stress management, in fact, exercise will help to reduce the stress itself. Okay, obesity. We all talk about obesity. I just want to show you some facts that the more obese you are, your blood pressure go up. Right? So these two charts itself basically share the same thing. One is the BMI scale, which means that as your BMI go up, your body is more obese, right? Then your blood pressure, the black one is a systolic, the white one is a diastolic. You can see from there, as your BMI increases, your blood pressure go up, all right? Go up. Again, another way to measure, instead of BMI, you also can measure your waist circumference. Same thing also, the blood pressure go up accordingly, but never mind, right? More important in here, there's another study, right? This is a study on Korean study, which basically is more representing Asian, what they call Asian, Asian body, all right? And basically, study between male and female. They want to differentiate whether male and female make a difference in terms of obesity or not. The answer is very simple. You look at the chart, both male and female, as your BMI go up, your blood pressure go up, no different. So don't hope that you're male or you're female, you're luckier than the others. The same, The answer is the same. Okay, now physical exercise. Very important because those are the things that you can do well, right? So bottom line is that how much of exercise is optimal, right? So if you look at it itself, exercise does reduce your systolic blood pressure and also reduce your diastolic blood pressure, okay? The exercise can reduce, right? As your exercise, aerobic exercise minutes per week, these are minutes per week, that means the intensity increases itself, right? Your blood pressure drop. Now you can see the chart, all blood pressure drop. All right. Now, important thing is that the blood pressure drop is not a linear curve. It's actually a curve that is go down and then it flatten up. And some of them, in fact, it does go up, a slight U curve itself. What it means, there is an optimum point of exercise for you to reduce your blood pressure. Doesn't mean that the more exercise, proportionally, the blood pressure will keep on going down. It doesn't happen that way. All right? So remember, it doesn't mean that you have to, the more exercise you are, the lower the blood pressure you will get. You won't get that way, right? So the greatest decrement is at 150 minutes per week of exercise, right? You have achieved a drop of your systolic pressure of 7 point and close to about 6 point in diastolic blood pressure. So this is a study that tell you that, right? Yes, exercise drop blood pressure, but there is an optimum point for exercise itself. So what it means to us, actually, for those who walk, you can take 6,000 to 8,000 steps, or equal to 4.5 to 6.5 kilometers a day, once or twice per week. This is the equivalent of this point, all right? Or you exercise 100 to 150 minutes per week, or 20 to 30 minutes per day, 5 times per week. So these are the conclusion of this study. Itself there, but you want an optimum point for exercise, these are the exercises suffice for you. Now, another way to look at it itself is the risk of stroke, heart failure, right? Heart attack, and peripheral artery diseases reduction because they're involving complication, right? So we look at it itself. Your exercise itself also actually reduce the stroke, risk of stroke. Your exercise reduce the risk of heart failure, right? Your exercise reduce your risk of heart attack. But also remember, the curves are not linear. They are actually U-shaped, U-shaped, and U-shaped, right? So there is an optimum point of exercise, right? Bottom line, WHO recommend 600 to 1,000 metabolic exercise time per minute, MET minutes. What does it mean? Basically, these MET minutes per week are translated to your walking and running, right? Which means that actually for walking, you spend 150 minutes to 250 minutes per week of walking, right? Running, you can spend between 75 minutes to 135 minutes per week of running. So this will be the optimum point for exercise itself, right? So just for you all have an idea, when you do exercise for reducing your blood pressure, right? Basically, your bottom line is to reduce the complication. And there is an optimum point for exercise. Okay? All right. Now, food. What are the food that can affect your blood pressure? Sodium, I mentioned, sodium, very important. In blood pressure control, the key ingredient in the food is sodium. Blood pressure increase with sodium intake. I will show you some chart as to how does it affect our blood pressure. Another key compound is potassium. Potassium intake decrease the blood pressure. That means that blood pressure decrease with potassium intake. Okay, so sodium, you all know, is salt. Potassium is a compound that's very common in a lot of what they call healthy vegetable fruits. Okay, alcohol intake increase the blood pressure. Caffeine intake decrease your blood pressure, right? So it's good news for people who take coffee and tea. It helps to reduce your blood pressure, right? Another compound that I want to mention here is licorice. Licorice actually is the TCM herbs, 甘草, Chinese name called 甘草. Taking licorice increase your blood pressure. So it is very important. Why I mentioned licorice and here is because licorice is a common ingredient in a lot of TCM formulation. Then a lot of people take TCM formulation for a long term. They're unaware that actually long-term consumption of licorice might increase their blood pressure. Right? So therefore, be very careful about formulation that contain licorice. Okay. All right. Now let's look at the sodium. As I mentioned, it's very important. The first most important ingredient to understand on blood pressure management is sodium. Higher sodium intake is associated with an increased risk of hypertension. So I show you the increase of hypertension, the blood pressure in the systolic blood pressure and the diastolic blood pressure, the upper number and the lower number. As your sodium intake in this case, 2 grams is set as a reference point, as standard. A common reference of the daily intake of sodium is 2 grams per day. As you intake more than 2 grams per day, your upper blood pressure, which is a systolic blood pressure, goes up in a straight line, right? You can see the very steep increase. Same thing for diastolic, which is the bottom number. Also, you go up. So that means that if you take higher amount of sodium, your blood pressure, both the higher number, bottom number, and the upper number, both go up on that. Okay, let's look at another form of presentation. Right. So we take 2 groups. One group is with hypertension patient. One group is without hypertension. It means that your blood pressure has been normal. Right. For the normal person, you take sugar and you take your sugar more than 2 grams. Right. Your blood pressure increase are very gentle. That means that there's not a lot of impact on the blood pressure increase. So healthy people with low normal blood pressure can afford to take more sodium without adversely affecting your blood pressure. However, if you already suffer from hypertension, then if you take any excessive amount of sodium, the blood pressure increase is very steep. That means it's very sensitive to people who are already at hypertension. What it means is that the more serious is the hypertension, the more sensitive you are to the sodium intake, salt intake. So more so for people who are suffering from hypertension should not take sodium, right? People who are not suffering from hypertension can afford to take more salty food. All right, so that's the bottom line. Okay, now we talk about potassium. Potassium present in a lot of fruits, right? It's present in banana, in potatoes, in a lot of fruits. A lot of actually healthy food we call so-called healthy food contain high amount of potassium, right? Including the famous noni juice of Atomic, all right? So it contains high amount of potassium. So we talk about intake of potassium. If you intake potassium, your blood pressure can go down. Now let's look at how potassium affects our blood pressure. So this is the upper number, systolic blood pressure. So as you take your potassium between 70 to 130 potassium per day, your blood pressure show a drop in this point, right? After that, the blood pressure slightly go up. Similarly, your diastolic blood pressure also, as you take your potassium between this 90, 70 to 130, right? You will drop to an optimum point, then you go up slightly. What it means, if you don't have potassium, enough potassium, your blood pressure go up here, right? That means that you must take enough potassium. Potassium deficiency causes hypertension. That's one point. But excessive potassium also can cause hypertension. So there is an optimum point of taking potassium. That means that you should not lack of potassium intake in your diet, but you should not overdose on potassium intake either, right? So therefore, in that respect itself, therefore you can see that why is it market doesn't have potassium supplement, right? The reason is because that potassium supplement is basically unnecessary because there is a lot of healthy food contain enough potassium in the diet intake itself. All right. So there's point to carry on from here. Okay. Now let's look at the diet. When we talk about our management of hypertension, the relevant thing is that every day we have to know what to eat, right, in order to manage it. That's a lifestyle management. So you can see from here is a very extensive study of a clinical study of various types of food that is affecting our blood pressure. The red one represents the category of food that is actually causing increase in blood pressure, right? That means that food that we should avoid or minimize taking. The one that we should avoid and minimize are the meat, poultry, fish, and eggs. This is what the study showed, right? Because you have actually hypertension risk on that. While the starchy food also increase the risk of hypertension. What are the healthy food category? Milk and dairy products, fruits and vegetable, right? So generally, this is the idea, right? So if you're having a hypertension, you want to manage your diet, right? Milk and dairy product, fruits and vegetable is good for you. Starchy food is not good for you, right? Meat is not good for you. Right, let's go a bit further. Okay, let's look at the diet. There's a study on the type of diet that's suitable for you and how effective it is in reducing your blood pressure, right? So basically, actually, this diet is using sodium restriction. It means that very low sodium plus what we call a DASH diet. DASH diet are basically nothing much than our normal healthy diet. I put it that way. So don't need to be too complicated. You basically a lot of fruits and vegetables, a lot of grains, lean meats, and low-fat dairy. Okay. So coupled with sodium restriction, then you can see from here that on the systolic blood pressure reduction, right? If your blood pressure, your blood pressure is normal, actually the reduction are not significant, right? But as your blood pressure are higher and you're suffering from higher blood pressure, hypertension, your reduction in with the diet is very significant. So which means that diet is actually very effective for people who are having hypertension, especially severe hypertension. Similarly, it works for the diastolic side. So more significant actually is on the systolic. That means the upper reading itself, the reduction can be very significant itself, right? But key thing, the point is that your diet should be low sodium and healthy diet. Low sodium, healthy diet. Okay? So now, what other thing? Not only the diet, just look at the drinks itself. So in here, you can see that the coffee helps to reduce the blood pressure. So coffee is good for people with hypertension, but soft drink and alcohol are no good. All right. Now, what are the supplements? Omega-3 are beneficial. Calcium and magnesium are beneficial for people who are suffering from hypertension. All right. Okay. Now, what are the blood pressure lowering supplements? Right. I show you here those actually the herbs first. Right. There's two very significant herbs that I pick it up is because that these two have the most extensive actual clinical study on the blood pressure reduction, right, and very credible. So therefore, one of them is a hibiscus flower. So actually hibiscus drink itself, not so common, I'm not sure, but then this seems to be a lot of study on this. Then the other one is actually the ginseng, planted ginseng itself, also have shown that are able to effectively reduce blood pressure by this amount. These are actually the study results that I actually tabulated. Now on the herb side, I just want to highlight, right? Actually, herbs are more effective in reducing blood pressure than the spices are more effective in reducing your blood pressure than the herbs. If you look at this chart, you can see that the garlic, especially the reduction of the blood pressure efficacy is much more higher than even the hibiscus and the ginseng. Right? You can see from there, and the evidence are very strong. Level evidence means a clinical study. The level evidence are very strong. So celery, ginger, and cinnamon are also equally effective spices. So if you look at it itself, you do not need to actually take what they call TCM formulation for that matter. Right. In fact, if you do well, you can do well with actually with spices alone in your diet. Yeah, these are the effective spices that you can use on the daily diet to actually help reduce the blood pressure. Now, supplement-wise, right? Now here I list the important supplements that have impact on blood pressure. CoQ10 stand up to be the one of the top most effective supplement for blood pressure reduction. Unfortunately, and I'll be careful about that, is because I want to mention is that while I say it's very effective, so a lot of people might jump into it and say, okay, start taking CoQ10. But there is again a U-shaped curve in your dosage. That means that if you look at this itself, both the systolic blood pressure and the diastolic blood pressure and the amount of CoQ10 you take itself, there is an optimum point of reduction of the blood pressure. But beyond that point, if you overdose on the CoQ10, the blood pressure actually go up, it get worse. Right? So hence all, I want to give a point to everybody, everybody in here. This is basically the point that supplementation. A lot of people does not understand the concept of supplementation. If you look at all the studies, it shows you that supplementation means that it's not a linear curve in terms of performance, efficacy. You supplement just the right dosage. There is an optimum dosage. Beyond that, over supplementation actually can have adverse effects. This is a very classical example of an adverse effect of a supplementation that's overdose, right? So instead of reducing your blood pressure, actually you increase your blood pressure if you overdose on CoQ10, right? Now I say CoQ10 is very effective. You can see from there that 10-point and 5-point reduction, right? But you have to be very careful that you must add the right dosage itself, all right? Similarly, L-arginine, alpha ALA, all these are important supplement that's well studied. and they also actually can show certain degree of effectiveness in using high blood pressure. I will skip these two, right? I'll talk about nitrokinesis, omega-3, and magnesium, because these three are the one that's relevant to Atomic's product itself, right? You can see that the scale of reduction, or the quantum of blood pressure reduction, are much smaller. So they are not actually as effective as compared with the spices, and also not so effective as compared with all these other supplements here. So I just want to mention, while they are beneficial for people who are hypertension, they are not a potent supplementation in hypertension. Not a potent supplementation. Okay,